At 2:13 in the morning, the man in the surgeon's cap locked the door to room 814 and reached beneath his gown. Nurse Mara Bennett saw the movement in the reflection of the dark television screen before anyone else in the room understood what it meant. The wounded general was half awake in the bed, one arm immobilized, an oxygen line beneath his nose, his face gray with the kind of exhaustion that came after blood loss, surgery, and 20 hours of people telling him to rest. The man beside him was supposed to be a trauma surgeon. He had introduced himself as Dr. Adrian Kell. He had the right badge, the right blue cap, the right surgical mask. He had spoken to the night clerk in the impatient, clipped tone of a physician who expected doors to open. And now he was drawing a compact black handgun from beneath his gown. Mara did not shout. That was the first thing everyone remembered later. She moved. Her left hand knocked the medication tray sideways. Metal struck tile. The sound made the fake surgeon turn his head for half a second. That half second was enough. Mara crossed the space between them, drove his gun hand away from the bed, and hit him with enough force to send both of them into the visitor chair. The weapon clattered beneath the cabinet. The man swore and came back at her. He was larger. He was prepared. He was not expecting the quiet night nurse to know what to do when a room turned violent. Mara caught his wrist, redirected him away from the general, and forced him down long enough for the first military security officer to burst through the door. Then a second. Then hospital security. The room filled with boots, orders, and hands. The attacker was pinned to the floor. The gun was recovered. And through all of it, General Nathan Calder lay in the bed staring at Mara as though he had seen a ghost. Not because she had saved him, because of the way she had done it. He knew that movement. He knew that stillness. He knew the woman. "Mara," he said hoarsely. She turned toward him. His eyes sharpened through the pain medication. Then he used a name nobody at St. Catherine's Medical Center had heard in 6 years. "Sergeant Bennett?" The room went silent. Dr. Marshall Vane, chief of trauma surgery, had arrived in the doorway in time to hear it. So had Colonel Elias Grant from the General's protective detail. So had 3 nurses who had spent the last year watching Dr. Vane correct Mara in public, assign her the worst rotations, and refer to her as reliable but limited. Nobody spoke. On the floor, the fake surgeon stopped struggling. Mara looked at the general, then at the gun beneath the evidence marker, then at the people staring at her. And she understood that the quiet life she had spent 6 years building had just ended at 2:13 in the morning in room 814. Before we go any further, if you like stories about the people everyone overlooks until the moment everything goes wrong, subscribe and stay with me until the end. Because the man with the gun was only the first thing St. Catherine's had failed to see that night. And tell me in the comments what city or country you're watching from. I always want to know how far these stories travel. Now let's go back 19 hours. Because at 7:06 that morning, nobody at St. Catherine's knew there was going to be an assassination attempt. Nobody knew a 4-star general would be brought through the emergency doors under another name. And nobody knew the nurse restocking saline in Trauma 4 had once spent 8 years keeping soldiers alive in places where hospitals did not exist. At 7:06 a.m., Mara Bennett was standing on a step stool arguing with a broken cabinet latch. Not loudly. Mara almost never did anything loudly. The latch on supply cabinet C had been failing for 3 weeks. Maintenance had repaired it twice. It still opened if anyone brushed the door hard enough, which meant expensive sterile supplies occasionally fell forward onto the floor. Mara had reported it. Twice. That morning she fixed it temporarily with a strip of medical tape and wrote the work order number on the tape in black marker so nobody could pretend the problem was new. "Creative," said a voice behind her. Mara stepped down. Dr. Marshall Vane stood in the doorway of Trauma 4, with a paper cup of coffee in one hand. He was 51, tall, silver beginning at his temples, and handsome in the polished way hospital brochures preferred. His white coat fit perfectly. His shoes never looked as though they had touched an emergency department floor. He had been chief of trauma for 7 years, and somewhere during year 4, competence had hardened into certainty. Mara had learned there was a difference. "The latch is still broken," she said. "So, call maintenance." "I did." "Then let maintenance handle it." She glanced at the tape. "Until it opens onto someone." Vane looked at the cabinet, then at her. The look was familiar. Not anger. Classification. Mara Bennett, nurse. Useful, quiet, prone to stepping 1 inch beyond the line he preferred. "You're in trauma 2 today," he said. "I'm scheduled for 4. Changed." "Why?" "Because Dr. Sloan requested 4. Dr. Sloan requested the nurse or the bay?" Vane's mouth tightened almost invisibly. "The bay." "Then I'll move." She removed her name card from the assignment board. That was how most disagreements with Marshal Vane ended. Not because he won them, because Mara had stopped believing every argument deserved her energy. She had been at St. Catherine's for 6 years. Long enough to know which residents panicked when blood pressure dropped. Long enough to know which elevators stalled between floors. Long enough to know that respiratory kept emergency tubing in the 2nd drawer from the bottom, even though the inventory sheet said 3rd. Long enough to know that a frightened family member standing alone beside the vending machines often needed information before they needed coffee. She was 36 years old, medium height, lean without looking athletic. With dark blonde hair she wore in a low knot, because ponytails got caught under protective equipment. Her eyes were gray-green. Her face was the kind people described as calm because they did not have another word for someone who did not perform every feeling in public. The staff liked her. Most of them. New nurses learned quickly that if Mara said, "Look at this again," you looked. Residents learned more slowly. Attending physicians learned according to personality. Dr. Lena Okafor, the senior emergency physician, had learned in 3 shifts. Marshal Vane had not learned in 6 years. At 7:28, Mara took handoff in Trauma 2. At 7:41, she caught a duplicate anticoagulant order before it reached the patient. At 8:03, she convinced an elderly man with a fractured wrist to call his daughter instead of trying to drive himself home after sedation. At 8:19, she noticed that a 19-year-old college student listed as anxiety/probable panic was breathing too carefully. Not fast. Carefully. There was a difference. Mara checked his oxygen saturation, listened to his lungs, asked him when the chest pain started, and requested a physician. The resident assigned to him, Dr. Peter Hall, glanced at the monitor. SAT is 98. I know. Heart rate is elevated because he's anxious. I know. He looked at her. Mara pointed at the patient. He's splinting on the left. Hall watched the young man take one shallow breath, then another. What are you thinking? Ask him about yesterday. Hall did. The patient admitted he had fallen hard during lacrosse practice and had not told anyone because he had a scholarship evaluation that week. Imaging showed a small pneumothorax. Nothing dramatic. Nothing that would become a story. They treated it before it became one. Hall found Mara 20 minutes later. Good catch. His breathing caught it, she said. He smiled because he was still new enough to appreciate the distinction. At 9:12, the trauma radio changed the day. The dispatcher's voice came through the overhead unit with a tightness that made everyone at the central desk stop what they were doing. Incoming priority trauma. Male, approximately 60. Vehicle rollover with blunt chest and abdominal injury. Hypotensive in field. Altered mental status. Air transport 3 minutes out. Security notification attached. Dr. Okafor looked up from a chart. Security notification? The charge nurse, Denise Holloway, was already reading the supplemental message. Federal Protective Detail. Patient is a government principal. Vane appeared from the surgical corridor before anyone paged him. That was one of his skills. He had a remarkable instinct for cases that came with attention. What do we know? Holloway read from the screen. Male, 61. Unrestrained rear passenger. Vehicle hit on driver's side, rolled twice. One fatality on scene. Possible chest injury, possible pelvic injury. Pressure 86 systolic after fluids. Name? Calder. Mara, standing 6 feet away, stopped writing. Only for a second. Nobody noticed except Okafor. Okafor noticed most things. First name? Vane asked. Holloway scrolled. Thomas. Mara resumed writing. Thomas Calder was a common enough name. Nathan Calder was not. General Nathan Calder had commanded Joint Task Force Sentinel 12 years earlier, back when Mara Bennett had been 24 and wearing a uniform every day. There was no reason to think the incoming patient was him. No reason at all. Then the helicopter touched down on the roof. 4 minutes later, the trauma elevator opened. 2 flight medics came out first, pushing a gurney fast. Behind them came a man in civilian clothes with a military haircut and an earpiece. Behind him, another. The patient on the gurney had blood dried along one side of his face. His left arm was braced. His breathing was uneven. A cervical collar framed a face that had aged considerably since Mara last saw it. But age did not change the bones. It did not change the scar beside the right eyebrow. It did not change the voice. "Stop asking me the same damn question," the patient muttered when the flight medic tested his orientation again. Mara went still. General Nathan Calder. Not Thomas. Nathan. And suddenly she understood the false name. Vane moved to the head of the bed. Trauma 1. Let's go. The protective agent stepped into his path. Patient is admitted as Thomas Calder. Vane barely slowed. I don't care if his name is Santa Claus. If he's bleeding, he goes to Trauma 1. The agent looked at him. For the first time that morning, Mara almost smiled. They moved. Mara stayed where she was. Trauma 1 was not her assignment. 6 years ago, leaving the army had required Mara to learn something she had never learned in uniform. Not every emergency was hers. Not every person she knew needed her. Not every room became her responsibility just because she could see what might go wrong. She had worked hard at that. Trauma 1 filled with physicians, nurses, respiratory staff, imaging techs, and 2 security personnel who did not look like security personnel. Mara went back to Trauma 2. She checked the college student. She updated a medication chart. She changed a dressing. She did not look through the glass toward Trauma 1 more than 3 times. At 9:31, she heard Vane say, "Pressure is coming up." At 9:33, she heard Okafor say, "Not enough." At 9:35, someone requested more blood. At 9:37, General Calder's voice carried through the partially open door. "Where's Ruiz?" The agent outside answered. "Colonel Ruiz is en route, sir." The general cursed softly. Mara's hand tightened around the clipboard. Ruiz. Elena Ruiz had been a captain the last time Mara saw her. A surgical operations officer with a laugh too loud for briefing rooms and a habit of carrying cinnamon gum into places where cinnamon gum made no sense. If Elena was a colonel now, 12 years had done what 12 years did. Mara reminded herself she was working. At 9:43, Dr. Vane came out of Trauma 1. Bennett. She looked up. I need another experienced nurse in 1. Holloway's tied up. There were 4 nurses closer to him. Mara did not point that out. She set down the chart. Coming. The room smelled like blood, antiseptic, and warmed saline. General Calder was more alert now. That was not necessarily good. People sometimes became clearer just before they became worse. His eyes tracked the room without settling. Vane was reviewing imaging on the screen. Multiple rib fractures, clavicle fracture, splenic injury. No obvious aortic disruption. We're going upstairs. Okafor was at the other side of the bed. His pressure is still labile. We know why. Do we? Vane looked at her. Okafor pointed toward the monitor. His pulse pressure is narrowing again. Because he's bleeding. Maybe. Mara looked at the general. Not the monitor. His skin had gone paler around the mouth. There was a slight distension at the neck that could have meant nothing under the collar. His breath sounds had changed. Very slightly. She listened again. Vane was talking about operating room availability. Mara looked at Okafor. Okafor saw the look. What? Left side. Okafor listened. Her expression changed. Marshal. Vane did not turn. We're moving. Marshal, stop. That made him look. Okafor pointed. Breath sounds are worse on the left. Vane checked quickly. They were diminished on arrival. They're more diminished now. The general's oxygen saturation dropped 2 points. Then 3. Mara's eyes moved to the line of his trachea. Subtle. Not dramatic. Enough. His chest is changing, she said. Vane looked at her. I'm aware of his chest injuries. He's compensating. He's a trauma patient. Of course he's compensating. Okafor said. Marshal. The saturation dropped again. The monitor alarm changed tone. Vane's expression sharpened. He made the decision. The room moved. Mara had equipment in his hand before he asked for it. Not because she predicted him, because she had predicted the patient. The intervention stabilized Calder enough to move. Nobody thanked Mara. That was fine. The general did not see her. That was also fine. At least that was what she told herself as they wheeled him toward the surgical elevator. Then his head turned. His eyes found her. They stayed there. Not recognition. Not yet. Something closer to the body, remembering before the mind did. He looked at her for 3 seconds. Mara looked away first. At 10:02, General Nathan Calder disappeared behind the elevator doors. At 10:03, Marshal Vane turned to Mara in the corridor. That was Okafor's call, he said. Mara blinked. I know. You spoke over the room. I said his chest was changing. You said it while I was giving direction. Yes. His jaw tightened. You have good instincts, Bennett. I've told you that before. It was the sentence he used when he was about to reduce someone. But instincts are not authority. Mara looked through the closed elevator doors. No, she said. They're information. Information goes through the chain. He was deteriorating. And he was treated. Because the information reached you. Vane's eyes cooled. There were 2 residents nearby. A transporter. A respiratory therapist. Mara knew what came next. He preferred witnesses when establishing hierarchy. You are a nurse in my trauma department, he said. A very capable one. But you have a persistent habit of behaving as though capability erases role boundaries. Mara felt the old part of herself move. The part that had once answered rank with rank. The part that had stood in dust, darkness, and rotor wash giving orders to people who technically outranked her because somebody's airway did not care about insignia. She let that part pass. Understood, she said. Vane nodded once. Good. He walked away. The respiratory therapist beside Mara waited until Vane was out of earshot. Then he said, For what it's worth, you were right. Mara looked at him. "For what it's worth," she said. "So was the monitor." She went back to work. At 10:17, in a surgical suite 2 floors above, General Nathan Calder went under anesthesia. At 10:22, a black sedan turned into the visitor garage at St. Catherine's. The man driving it wore no uniform. He parked on level 3. He sat behind the wheel for 43 seconds. Then he opened a slim case on the passenger seat and removed a hospital ID badge bearing the name Dr. Adrian Kell. The photograph was his. The credentials were not. He clipped the badge to his jacket, closed the case, and walked toward the elevator. At 10:31, the man calling himself Adrian Kell walked into the main lobby and stopped beneath a directory sign. He did not look lost. He looked patient. There was a difference. The morning lobby at St. Catherine's moved around him in predictable layers. Visitors checking in, volunteers giving directions, wheelchairs rolling toward elevators, staff moving too quickly to be interrupted. He stood still long enough to become invisible in the middle of all of it. Then he went to the surgical floor. He did not ask for General Nathan Calder. He asked for the federal trauma transfer from this morning. The clerk at the desk frowned. "We don't give out room information on protected patients." Kell smiled politely and tapped the badge clipped to his chest. "I'm consulting. Name? Dr. Adrian Kell. Vascular." The clerk typed. Something on her screen satisfied her. "Not roomed yet. Still in OR." "Thank you." He walked away. The interaction took less than 30 seconds. Nothing about it looked dramatic. That was why nobody remembered it until much later. At 11:04, Mara was eating yogurt in the break room when Colonel Elena Ruiz walked in. Mara almost dropped the spoon. 12 years had changed Elena in the ways Mara expected, and one she did not. The hair that had once been black was streaked with silver near both temples. The rank on her uniform had changed. The posture had not. Neither had the eyes. Elena stopped 2 steps inside the room. For a moment, she simply stared. Mara was seated alone at the small round table beside the refrigerator. Teal scrubs, badge clipped crookedly, because the plastic holder had cracked that morning, half a cup of coffee cooling beside her. Not a uniform, not body armor, not dust. Not 12 years ago. Elena whispered, "No way." Mara put the spoon down. "Hi, Elena." Colonel Ruiz shut the door behind her. "You knew." "Knew what?" "Who the patient was." "After he came in." "And you didn't call me?" "You were already coming." "That is not an answer." "It's the one I have." Elena looked at her the way she used to look at maps with missing information. Mara remembered that look. She had missed it more than she wanted to admit. "I heard a nurse caught the chest change downstairs," Elena said. Mara looked at the yogurt. "So did Dr. Okafor." "I asked who noticed it first." "Elena." "Mara." The old cadence arrived between them so naturally that both women went quiet afterward. Elena crossed the room and sat opposite her. 6 years, she said. Mara corrected her. 6 years and 4 months. You vanished. I resigned. You changed your number. Yes. You returned 3 letters unopened. They weren't yours. No, they were Calder's. Mara looked up. Elena's expression softened a fraction. He wrote you after the inquiry closed. I know. You never read them? No. Elena sat back. The refrigerator compressor kicked on behind them. For a hospital break room, it was suddenly very quiet. Do you know why he's here? Elena asked. Mara's eyes moved to her. Car crash. That's what everyone in this building gets to know. Then that's what I know. Elena studied her. You're really doing this. Doing what? Being exactly what your badge says and nothing else. Mara looked down at the blue plastic rectangle clipped to her scrub top. Mara Bennett, RN. I am what my badge says. I didn't say you weren't. Then don't make it sound smaller. Elena's face changed. That landed. Mara hated that she was glad it did. For a few seconds, neither spoke. Then Elena nodded. Fair. She stood. Calder is still in surgery. 2 injuries were worse than the field report suggested. Vane thinks another 2 hours. Who else is with you? Colonel Grant is running protection. 2 agents from Defense Protective Service. More coming. Why so much security for a vehicle accident? Elena hesitated. It was brief, but Mara saw it. Mara had spent 8 years learning how people hesitated when information was compartmented. She felt something cold settle under her ribs. Elena. Ruiz looked toward the door. The accident may not have been an accident. Mara stopped moving. That's all I can tell you. Then you shouldn't have told me that. I know. Does Vane know? He knows the patient is protected and that access is restricted. He does not know why. Does hospital administration? The CEO and chief medical officer know the same thing. Mara thought about the agents outside Trauma 1. The false name. The speed with which Calder had been moved upstairs. Was the fatality on scene one of his people? Elena's jaw tightened. Yes. Mara closed her eyes for 1 second. Who? Major Daniel Keene. The name hit harder than she expected. Daniel had been a lieutenant when Mara knew him. 26, relentlessly optimistic, terrible at cards, convinced every mission could be improved by hot sauce. He had once spent 3 hours holding pressure on a stranger's wound in the back of a vehicle because there was nobody else to do it. Mara had not spoken to him in 11 years. That did not make the loss small. I'm sorry, she said. Elena nodded. So am I. Then she left. Mara sat alone with the yogurt she no longer wanted. At 11:19, a man wearing a vascular surgery badge stood at the far end of the surgical corridor and watched Colonel Ruiz enter a secured room. He did not approach. He turned around and walked toward the elevators. At 11:26, he used a staff lounge phone to make a call that lasted 11 seconds. At 11:37, he left the surgical floor. At 11:51, Mara found Dr. Adrian Kell in the emergency department. She did not know his name yet. He was standing at the central desk, speaking with Denise Holloway. Mara was 10 feet away, checking a discharge packet. She noticed him because he was wearing surgical blues and a white coat, but no stethoscope, no pen, no folded patient list, no phone in his hand, nothing that made him look as though he had actually been working in a hospital all morning. That was not suspicious by itself. Surgeons appeared in emergency departments carrying less than common sense every day. What caught her attention was his gaze. He was talking to Denise, but he was watching the elevator. Mara signed the discharge form. The patient thanked her. She smiled. The man at the desk glanced toward her. Their eyes met. His moved away first. Can I help you? Denise asked him. Looking for Dr. Vane. He's upstairs. I was told he might be down here. Not for the last hour. The man gave an easy shrug. My mistake. He walked away. Mara watched him go. Denise noticed. What? Who was that? Vascular consult. Kell. From here? Apparently. Mara looked at the disappearing white coat. Apparently? He's in the system. What did he want? Vane. Mara glanced at the trauma elevator. Why? Denise gave her a look. You want me to ask every doctor why they want another doctor? No. Good, because I have a waiting room with 43 people and exactly 1 clerk who just called out sick. Mara nodded. She went back to work. But she remembered the man. Not because he had done anything wrong. Because he had watched the elevator instead of the person speaking to him. At 12:18, General Calder was still in surgery. At 12:34, Marshal Vane came downstairs for less than 5 minutes and found Mara at the medication station. "I need you upstairs at 1400, he said. "For Calder?" His eyes narrowed slightly. "You know his identity." I recognized him. "How?" Mara opened a medication drawer. "I served in the army." Vane waited. "That's it?" "That's enough." He did not like that answer. Mara could see it. But he needed her more than he needed the answer. "He'll be in surgical ICU. We're keeping staffing limited. Holloway recommended you for the first rotation because you've handled protected patients before." "I have." "When?" "Before I worked here." Again, the answer did not satisfy him. Again, he let it go. 1400. "I'll be there." He started away. Mara said, "Dr. Vane." He turned. "Do we have a vascular surgeon named Adrian Kell?" Vane frowned. "Why?" "One was looking for you." "I don't know every vascular surgeon on credential." He said he was consulting. "On what?" He didn't say. Vane stared at her for a beat, then exhaled. "Bennett, not every unfamiliar face is a problem. I didn't say he was. You're asking me to audit a credential because a physician looked unfamiliar to you. I'm asking if you know him." And I answered. He walked away. Mara closed the drawer. The answer bothered her less than the tone. Not because Vane had been dismissive. She was used to that. Because part of her had been hoping he would say, yes. "I know Kell. He's expected." He had not. At 1:02, the man with Kell's badge sat in a cafe across the street from St. Catherine's and drank half a cup of coffee. He checked his watch twice. At 1:16, he received a message. "Room 814 after recovery. Night shift thinner. Wait." He read it once, deleted it, and finished the coffee. At 1:48, Mara changed into fresh scrubs. Protected patient care at St. Catherine's came with rules. No personal phones in the room. No visitors without security clearance. No names on public boards. No discussion in hallways. No casual photography. Mara had followed stricter rules in less forgiving places. She signed the confidentiality addendum without reading it twice. The nurse manager, Denise Holloway, watched her. "You really knew him?" "Years ago." "What kind of army nurse were you?" "I wasn't a nurse then." Denise raised her eyebrows. "What were you?" Mara clipped a fresh badge holder to her scrub top. "A medic." Denise waited for more. Mara did not give it. "Of course," Denise muttered. "What does that mean?" "It means every time I learn something about you, it explains 3 things and creates 5 questions." Mara smiled faintly. "That sounds inefficient." "It is." They took the elevator to 8. General Calder arrived from recovery at 2:11 p.m. He looked worse than he had before surgery. That was normal. Surgery fixed things by injuring a person in controlled ways. The body did not care that the damage was therapeutic. It still had to recover from it. Calder had required splenic repair, control of internal bleeding, stabilization of his clavicle, and treatment for the chest injury. He had not needed a ventilator after recovery, which was good. His pressure was acceptable with support. His pain was controlled enough that he could answer questions without cursing every person in the room. That lasted 7 minutes. Then he told Vane the bed was uncomfortable, the lights were too bright, and if anyone asked him his birth date again, he intended to invent a new one. Vane almost laughed. Mara did not. She had heard Calder complain through injuries more serious than this. It meant he was frightened, not panicked. Calder did not panic. But fear had different uniforms. Sometimes it sounded like irritation. Mara adjusted the light. The general watched her hand, then her face. His eyes narrowed. "Do I know you?" Vane looked between them. Mara checked the monitor. "We met a long time ago, sir." Calder stared. "Where?" "You should rest." That is what people say when they don't want to answer a general. It's what nurses say when generals are fresh out of surgery. Something moved in his face, a shadow of amusement. Then pain tightened his mouth and the moment passed. Vane said, "General, Nurse Bennett will be part of your care team. She's one of our most experienced trauma nurses." The compliment surprised Mara enough that she looked at him. Vane did not look back. Calder closed his eyes. "Bennett," he murmured. The name moved through memory. Mara could almost see it happening. Not yet. She hoped not yet. At 2:32, Colonel Elena Ruiz entered room 814. Calder opened one eye. "You look terrible," Elena said. "So do you." "I wasn't in the car." "Then you have less excuse." Mara turned away to hide the smile. Elena saw it. Calder saw Elena see it. His gaze sharpened again. "Wait." Mara's hand stopped over the chart. Calder looked at Elena, then at Mara. "Elena." Ruiz went still. "Sir, why does my nurse look like Bennett?" Mara closed the chart. Elena's face did the specific thing it did when she had stepped onto a minefield she had personally watched someone bury. "Because," Elena said carefully, "that is Bennett." Calder stared at Mara. The room was suddenly too small. He pushed himself slightly higher against the pillow. Pain stopped him. Mara moved automatically. "Don't. Sergeant Bennett, not anymore." His eyes widened. "You're alive." Mara frowned. That was never in question. Elena looked down. Calder's expression changed. Not confusion. Realization. "No," he said softly, "not literally." Mara knew what he meant. She looked at the monitor. The silence stretched. Vane, who had been standing near the door, looked from one face to another. "What exactly did Sergeant Bennett do?" he asked. Mara said, "Nothing relevant to his care today." Calder looked at Vane. "Doctor, how much do you know about your nurse?" Vane's answer came too quickly. "Enough." Calder almost smiled. "No," he said, "you don't." Mara felt heat rise at the back of her neck. "Sir." Calder looked at her. She did not need to say more. He knew that look too. He let the subject drop. For the moment. At 3:06, outside room 814, Vane stopped Mara in the hallway. "You were special operations?" Mara looked at him. "Where did you get that?" "Calder called you sergeant. Ruiz clearly knows you. The general just implied I don't know something important. I can add. Apparently not accurately. What did you do?" "I was an army medic." "You said that downstairs." "That's because it remains true upstairs." His jaw shifted. "Mara." He rarely used her first name. She waited. "I'm responsible for this patient. If there is some prior relationship that affects your judgment, it doesn't. You can't know that. I can. You already inserted yourself into his care downstairs." "I was assigned by you. You know what I mean." "Yes," Mara said. "I do." She looked toward the room. "He was deteriorating. I said so. If that threatens your authority, that is not a clinical problem." Vane's face hardened. "Be very careful." "With what?" "With confusing whatever you were before this hospital with what you are here." There it was. Mara felt something settle inside her. Not anger. Clarity. "What I am here," she said, Is the nurse you asked to watch a wounded man through his first post-operative hours. So that is what I'm going to do. She walked past him. Vane did not stop her. At 3:21, Mara found the first thing that did not belong. It was not a weapon. It was not a threat. It was a consult note. A vascular review had been opened on Calder's chart at 11:46 a.m. and closed without documentation. The physician name attached to the access was Adrian Kell. Mara read the line twice. She called medical staff services. A woman named Patrice answered. Can you confirm whether Dr. Adrian Kell is on service today? Department? Vascular. Keyboard sounds. Yes. Credentialed locum. First day was supposed to be Monday. Supposed to be? He delayed. Travel issue. Why? Has he started? More keyboard sounds. I have an activation in the system this morning. Who activated it? Automated credential sync after orientation completion. Did he complete orientation in person? A pause. That's HR. I can transfer you. Mara looked down the hallway. Colonel Grant stood outside the room, speaking quietly into an earpiece. I'll call back. She hung up. Grant noticed her expression. What? There was a vascular surgeon looking for Dr. Vane earlier. Name? Adrian Kell. Problem? I don't know. Grant waited. Mara appreciated that. He did not fill the silence with dismissal. I asked Vane if he knew him. He didn't. Kell accessed the general's chart before surgery ended. Medical staff says he's a new locum whose credentials activated today. Grant's face changed by less than a millimeter. For someone like Grant, that was enough. What did he look like? Mara described him. Grant took out his phone. Stay here. I am here. I mean, don't go looking for him. Mara looked at him. He held the look. Something in his expression suggested he knew exactly what kind of person needed to be told that. I won't, she said. It was not entirely a lie. She had no intention of going anywhere. But she did intend to keep watching. At 3:44, Colonel Grant returned. We're checking the credential. Was he cleared to access Calder? No. Then how did he open the chart? Hospital question. Useful answer. His mouth twitched. Elena said you were like this. Like what? Annoying when you're right. She's one to talk. Grant's expression warmed for exactly 1 second. Then it disappeared. The patient's protection level is being increased. Nobody enters without my team verifying them, including physicians. Tell Vane before he discovers that from someone else. I already did. How'd that go? Poorly. Mara almost smiled. At 4:07, Dr. Marshall Vane walked into the nurse station looking like a man who had just been informed his authority ended 6 inches outside a federal security perimeter. Bennett. Mara looked up. He lowered his voice. Did you report a physician to the general's security detail? I reported an inconsistency. Without bringing it to me. I brought it to you at 12:34. You asked if I knew him. Yes. That is not the same thing as telling me you suspected a security threat. I didn't suspect one then. And now? Now I suspect the credential deserves verification. Vane stared. This is a hospital, not a deployment. Mara's face went still. I know exactly where I am. Do you? Because ever since Calder arrived, you have been acting differently. How? More aggressive. Mara considered that. No. No? Less deferential. The distinction landed harder than she intended. Vane's mouth flattened. You are not part of his security detail. I know. Then stop behaving like you are. I'm behaving like his nurse. His nurse does not investigate physicians. His nurse notices who opens his chart. Vane leaned closer. If you create panic around this patient, based on some old military instinct. Mara cut him off. Stop calling it instinct. The words were quiet. Vane stopped. Mara continued. Instinct is what people call pattern recognition when they don't want to admit there was information available before they saw it. For a moment, neither moved. Then Dr. Okafor, who had approached unnoticed, said, "That is the most accurate thing anyone has said in this hallway all day." Vane turned. Okafor held a chart against her chest. "Marshal, security wants you at the desk." "Why?" "They found something." Vane looked at Mara once more, then walked away. Mara watched him go. Okafor stood beside her. "What did they find?" Mara asked. "No idea. You lied. Efficiently." Mara looked at her. Okafor shrugged. "He needed to leave before he said something he'd regret, and you said something he deserved." "That's manipulative. Clinical de-escalation." Mara laughed once. It surprised both of them. At 4:29, General Calder woke fully enough to ask for water. Mara gave him ice chips instead. He glared. "You always were mean." She stopped. "You remember now." "I remembered when you told Vane the chest was changing." "That was hours ago. I had other things happening." "That is one way to describe surgery." His eyes settled on her. The humor faded. "You left without saying goodbye." Mara looked at the cup in her hand. "So did a lot of people." "That isn't an answer." "No." He waited. She had forgotten how patient Nathan Calder could be when patience was a weapon. "I was done," she said finally. "With the army?" "With being known only for the worst day in every room." Calder's face changed. Mara immediately regretted saying it. Not because it was untrue, because it was more true than she normally allowed in public. The general looked toward the window. Outside, late afternoon light had started turning the city glass gold. "Keene died this morning," he said. Mara's throat tightened. "Elena told me." "He was sitting 6 feet from me." She said nothing. "He had a daughter last year." "I didn't know." "Neither did I until 3 months ago." Calder closed his eyes. The monitor continued its steady rhythm. Mara stood beside him and did not try to improve the silence. After a while, he said, "The vehicle was hit deliberately." Mara looked at him. "You shouldn't tell me that." "I'm tired of people deciding what you should know. That is not a security policy." "No, it's guilt." His eyes opened. "We were carrying evidence to an inspector general review. Procurement fraud. Ghost contracts. Equipment that existed on invoices and nowhere else. Somebody knew the route." Mara's pulse slowed. That was what her body did when information became dangerous. Calder noticed. "You still do that." "Do what?" "Get calmer when everyone else should get nervous." "I am nervous." "No, you're not." "Yes," Mara said. "I am." He looked at her. She held his gaze. "Calm is not the absence of fear," she said. "It's what I learned to do with it." Calder was quiet. Then he nodded. "Fair." Mara leaned closer. "Who knew you were coming here?" He looked toward the door. "Very few people. Very few people." "Did they know this hospital specifically?" "Fewer." "Then your security team needs to assume the location is compromised." "They already do." "Because of the vehicle?" Calder looked at her. "Because you found a doctor nobody can currently verify." Mara went still. "What?" "Elena told me 10 minutes ago." Mara looked toward the door. Calder said, "Sit down." "I'm working." "You're thinking about searching the building." "I said I'm working." "That means yes." Mara looked at him. He almost smiled. Then the pain took the smile away. "Don't," he said. "That is becoming a popular instruction today." I'm serious. So am I. Mara. She stopped at the door. The general's voice was quieter. You don't owe me another mission. The sentence reached somewhere she had kept closed for years. She looked back at him. This isn't a mission, she said. What is it? My patient. She left before he could answer. At 5:02, hospital security located the name Adrian Kell in the credentialing system. At 5:09, they called the phone number attached to his temporary file. At 5:11, a man answered from a hotel 40 miles away. His name was Dr. Adrian Kell. He was a vascular surgeon. He had been recruited for a 3-week locum assignment at St. Catherine's, and he had not yet entered the hospital. His flight had been delayed until that afternoon. He was standing beside a rental car counter when security called. At 5:17, St. Catherine's initiated a restricted security alert. Not a lockdown. Not yet. A quiet alert. Badges checked. Exterior doors monitored. Protected floors restricted. Security footage pulled. Colonel Grant's team began reviewing every person who had entered the surgical wing since 10 a.m. At 5:24, they found the man on camera. White coat. Blue cap tucked into one pocket. Kell's badge. Face clear. At 5:28, Colonel Grant showed the still image to Mara. That him? Yes. You're certain? Yes. Grant looked at the screen. Security lost him at the west stairwell at 12:02. Lost him? No camera coverage between 7 and the garage connector. His car? Working on it. Mara looked down the corridor toward room 814. Then he could have left. Yes. Or changed clothes. Grant looked at her. Yes. Mara hated the answer. At 5:36, Vane requested that Mara be removed from Calder's room. He did it formally, through Denise Holloway. Denise looked unhappy when she delivered the message. He says security concerns have become disruptive to clinical care. Mara stared at her. Security concerns? He says your prior relationship with Calder is creating a conflict. Now? I know. The man I flagged is using a stolen identity. I know. And Vane thinks the problem is my prior relationship. I know. Denise rubbed her forehead. Mara, I am not defending this. I am telling you what he ordered. Mara looked toward room 814. 2 protective officers stood outside now. Colonel Grant was speaking with hospital security. The general was not alone. He was not unprotected. She knew that, knowing it did not make leaving easy. Who replaces me? Julia Kent. Mara nodded. Julia was good. Steady. 7 years in ICU. Not careless. Mara handed over every detail. Drain output. Pain pattern. Respiratory changes. Blood pressure trend. The exact way Calder minimized discomfort when he wanted people to stop asking questions. Julia listened. At the end, she said, "You want me to call you if anything feels wrong?" Yes. Even if Vane says not to. Mara looked at her. Julia lifted one shoulder. I've worked here longer than you. Then you're supposed to be wiser. I am. That's why I'll call. Mara left the floor at 5:58. At 6:04, she entered the staff elevator alone. At 6:05, the doors opened on 6. The man who had called himself Adrian Kell stepped in wearing gray maintenance coveralls. Mara looked at him. He looked at her. For 1 second, neither face changed. Then he pressed the button for the lobby. Mara felt every sound in the elevator separate. The fan above them, the faint vibration of the cables, the click of the button, his breathing, her own. He no longer wore glasses. His hair was flattened differently. The white coat was gone. The badge was gone. But it was him. Mara knew it. He knew she knew it. The elevator passed 5. 4. He looked at the floor numbers. Mara looked at his hands. Empty. At 3, he said, "Long day?" His voice confirmed it. Mara answered evenly. Not over yet. The elevator reached the lobby. The doors opened. He walked out. Mara waited half a second, then followed. Not close. Not dramatically. She took out her phone and called Colonel Grant. He answered immediately. "Bennett? The man in your image is in the lobby. Gray maintenance coveralls. Walking toward the east exit. Do not approach." "I'm not. Where are you?" 20 yards behind him. That counts as approach adjacent. Mara almost smiled despite herself. East exit. Grant was already moving on the other end. The man reached the doors, then stopped. 2 uniformed security officers were checking badges outside. He saw them, turned, and walked toward radiology instead. Mara's skin went cold. "He changed direction," she said. "Where?" "Radiology corridor. Stay where you are." "I am." She was not. She followed to the corner. The corridor beyond was empty. The man was gone. A service door stood slowly closing near the far wall. Mara said, "He used service access." Grant swore softly. "Back to a public area, now." This time she listened. At 6:11, the hospital moved from restricted alert to lockdown. The doors sealed. Security teams swept stairwells, service corridors, mechanical access points, and public rooms. They found the gray maintenance coveralls folded inside a linen hamper on level 5. They did not find the man. At 6:47, Mara sat in a conference room with Colonel Grant, Elena Ruiz, Dr. Vane, the hospital chief operating officer, and 2 federal investigators who had arrived without introductions, beyond first names and badges. The still image from the elevator camera was on the screen. The fake surgeon's face. Mara's face beside him. Vane looked at it for a long time. Then he said, "You followed him." Mara looked at him. "He was leaving. You were specifically told not to involve yourself." Colonel Grant's head turned. Mara said, "I reported his location. You followed him into a corridor during an active security event, and then left when instructed." Vane looked toward the federal investigators. "This is what I've been trying to explain. Nurse Bennett has a history of overstepping." Elena Ruiz put both hands flat on the table. The room changed. She did not raise her voice. "Doctor, the only reason you know there is an armed or potentially armed imposter somewhere in your hospital is because Nurse Bennett noticed him before your credentialing system did." Vane looked at her. "I'm not disputing that. You are doing something very close. I'm responsible for clinical operations, and Colonel Grant is responsible for protective operations," Elena said. "He has not complained about her report." Grant said, "I have not." Vane's jaw tightened. The chief operating officer cleared his throat. "Can we focus on locating the individual?" Mara looked at the building schematic on the screen. "Why would he change clothes but stay inside?" One investigator answered. "Because the exits were being watched. Or because he wasn't trying to leave." The room went quiet. Grant looked at her. Mara continued. "He had more than 5 hours between first entry and the alert. If leaving was the goal, he had time. He changed clothes before the lockdown." The investigator leaned forward. "You think the surgeon disguise was only for reconnaissance?" "I think he asked for Vane, accessed Calder's chart, learned the room assignment, then disappeared. If he wanted access while Calder was sedated or immediately post-operative, he had chances. He didn't use them." "Meaning?" Mara looked at the image. "He's waiting for something." Nobody spoke for 2 seconds. Then Grant said, "Shift change." Mara nodded. At 7. The chief operating officer went pale. The investigator stood. Lockdown 8. No staff rotation until cleared. Vane said, "You can't freeze an ICU shift indefinitely. We can for 15 minutes. That will cause staffing issues." Grant looked at him. "A man using a stolen physician identity is inside your building after a deliberate attack on a 4-star general. You have staffing issues." Vane said nothing. At 6:58, the normal shift change did not happen. At 7:03, 3 people tried to enter the 8th floor and were turned away because their access had not been individually verified. At 7:09, a food services employee discovered a discarded visitor jacket in a supply alcove. At 7:14, security dogs checked the west stairwell. At 7:22, federal agents found the fake surgeon's original white coat behind an unlocked storage panel near the surgical elevators. At 7:31, they found nothing else. At 8:00, the hospital remained locked. At 8:17, the search shifted to the parking structures and exterior grounds. At 8:43, hospital leadership began asking whether the intruder had already escaped through a route not covered by cameras. At 9:06, Vane told Mara to go home. She was standing at the 8th floor nurse station. He approached with the exhausted expression of someone who had been fighting the wrong battle for too long and did not yet know it. "Your shift ended 2 hours ago. I was held for the security interview." "That ended an hour ago." "I know." "Then, go home." Mara looked toward room 814. Julia was inside checking the general's vitals. 2 military officers were outside. Grant was 30 feet away. Calder was safe. Objectively. Mara knew that. Still, something was wrong. Not a fact. Not yet. A shape in the information. Vane followed her gaze. "He has more security than the president of this hospital. That is not a reassuring comparison. I'm serious. So am I." He exhaled. "You need sleep." Probably true. Mara looked at him. "Did you ever find out why Kell's credentials activated?" "That's being reviewed." "By whom?" "Administration." "Was his badge printed here?" Vane's eyes narrowed. "Go home, Bennett. That means you don't know. That means it is no longer your responsibility." Mara felt the words settle. No longer your responsibility. The sentence had followed her through half her adult life. Sometimes it was mercy. Sometimes it was cowardice. Sometimes it was simply true. The difficult part was knowing which. She nodded. "Okay." Vane seemed surprised that she agreed. Mara picked up her bag. At 9:18, she left the 8th floor. At 9:27, she changed in the locker room. At 9:34, she walked toward the employee garage. At 9:36, her phone rang. Julia Kent. Mara answered before the second ring. "What?" Julia's voice was low. "Calder's asking for you." "Why?" "He won't say." "What changed?" "Nothing clinically." Mara stopped walking. "That is not why you called." Julia was quiet for a second. Then she said, "A surgeon just called the unit. Said Vane requested a bedside vascular reassessment overnight." Mara's blood went cold. "Name?" "He didn't give one. He said he'd be up later." "Did you tell security?" "I'm looking at Colonel Grant right now." "Good." Mara. "Yes? Come back." Mara turned around. "I'm coming." At 9:38, the man who had entered St. Catherine's as Dr. Adrian Kell opened his eyes in an unused physician's sleep room on level 7. He had been there for 2 hours. His hospital map lay folded beneath the mattress. A clean set of surgical scrubs hung from the bathroom door. He checked the time. 3 hours and 35 minutes remained until 1:13 a.m. He had been told to wait until after midnight, until the building believed the danger had passed, until exhaustion did what locks could not. He sat up and began to get ready. Mara was back on 8 at 9:46 p.m. Colonel Grant met her at the elevator. "You were supposed to go home. So were you. I'm not hospital staff. Lucky you." He did not smile. Neither did she. "The call came from an internal line," Grant said as they walked. 7 East, physician sleep rooms. "Checked? Checking now. Camera coverage? Hallway only." Mara looked at him. He knew what she was thinking. "Don't." "I didn't say anything. You don't need to." They reached room 814. General Calder was awake. His face looked older under the night lighting. Pain had a way of removing rank. So did fear. He looked past Grant and saw Mara. Finally. She stopped beside the bed. "You requested me?" "Yes." "For what?" "To tell me if everyone is lying." Mara glanced at Grant. Grant said, "That's my cue to leave." "You're not leaving the hall," Calder said. "No, sir." The colonel stepped outside. Mara checked the general's monitor. "I'm not part of your investigation. I know. I don't know what they know. I know. Then I cannot tell you if everyone is lying." Calder watched her. "Your bedside manner is still terrible." "My patient satisfaction scores disagree. That is because civilians are soft." Mara almost laughed. She did not. Calder's expression changed. Keene's wife called. Mara looked at him. She asked if he suffered. The room became very quiet. "What did you tell her?" "The truth." "Which was?" "He didn't know what happened." Mara nodded. "That was the right truth." "There are wrong truths?" "Yes." Calder looked at the ceiling. "You always had an answer." "No. I was just young enough to think I should." He turned his head toward her. "You know what I remember about you?" Mara adjusted the line near his wrist. "I suspect you're going to tell me." "Not the medal." Her hand stopped. "Don't. Not the evacuation." "General. Not even Red Quarry." Mara's eyes lifted to his. That name had not been spoken in a hospital room in 12 years. It had barely been spoken anywhere. Calder continued before she could stop him. "I remember a boy in a village with a broken toy truck. We were moving out. Everyone was tired. You had been awake 30 hours. You sat on the ground and fixed one wheel with tape." Mara remembered. She had not thought about that boy in years. "He was crying," she said. "So were 3 grown men that day. You ignored them. They had fewer broken toys." Calder smiled faintly. Then his eyes grew serious. "You were never what the reports made you." "What did they make me?" "A weapon that carried bandages." Mara looked at him. The words hurt in a precise way. Not because they were cruel, because they described the reason she had left. "Maybe that's what I was," she said. "No. You didn't know me after. I knew enough before." Mara looked toward the door. Colonel Grant's silhouette moved beyond the glass. "I don't want this place to know," she said. Calder was quiet. "My record. I understand." "No, you don't." He waited. Mara surprised herself by continuing. "For 6 years, when someone thanks me, it's for staying 5 minutes after shift, or finding a blanket, or catching a medication error. Small things, normal things. They matter. I know. That is why you chose them." "Yes." Calder nodded slowly. "Then I won't tell them." Mara looked at him. "But," he added, "if somebody in this building calls you limited again, I reserve the right to develop a sudden problem with discretion." Mara laughed. This time she could not stop it. The sound lasted less than 2 seconds. Calder smiled. And for the first time all day, the room felt like a room instead of a perimeter. At 10:03, Julia returned with the results of the General's latest labs. Mara read them over her shoulder. Something in the trend bothered her. Not enough for alarm. Enough to watch. Output? Mara asked. Julia gave the number. Higher than earlier. Still within expected range. Expected is not the same as irrelevant. Julia nodded. I told Vane. What did he say? To repeat in 2 hours. Mara looked at Calder. His pressure was holding. Heart rate slightly faster. Pain slightly worse. Could be normal. Could be the beginning of something. She wrote the trend down. At 10:21, Dr. Vane arrived. He looked at Mara, then at the chart. You came back. Julia called. I know. There was something different in his tone. Not softer. Tired. The day had sanded some of the polish off him. He examined Calder, reviewed the data, and ordered repeat imaging if the next labs moved in the wrong direction. Mara agreed. Vane noticed. He almost seemed disappointed that she did not argue. At the door, he stopped. Security says the call came from an unused room. I heard. No one was found. I heard that too. They think he may have used the phone earlier and left. Do you? Vane looked at her. That is a security question. Mara nodded once. He had learned something. Maybe not enough. Something. Then he said, you should still go home. And she decided he had learned less than she hoped. At 10:47, General Calder's daughter arrived. Her name was Rebecca. She was 32, an elementary school principal from Maryland, and she entered room 814 with the controlled face of someone who had spent the entire drive refusing to imagine what she might find. Then she saw her father. The control broke. Not dramatically. Her hand went to her mouth. Her eyes filled, and she stood frozen just inside the door. Calder looked at her. Becca. She crossed the room in 3 steps. Mara stepped back. She had watched thousands of family reunions in hospitals. The best thing a nurse could do in some of them was disappear without leaving. Rebecca took her father's hand. You look awful. Calder sighed. Apparently this family has one greeting. She laughed and cried at the same time. Then she leaned carefully around the lines and hugged him. Calder closed his eyes. His face did something Mara had never seen in uniform. It became old, not weak, not less, just human in a way, rank often hid. Mara looked away. Rebecca stayed 20 minutes. Before leaving, she found Mara outside the room. You're Nurse Bennett? Yes. My dad said you saved him downstairs. Mara shook her head. The team treated him. He said you noticed something. So did Dr. Okafor. Rebecca smiled sadly. He also said you always do that. Mara looked toward the room. He's had a lot of medication. Rebecca's smile widened. I like you. That is a dangerous conclusion based on limited data. He said you talk like that too. Mara felt an uncomfortable warmth behind her ribs. Rebecca touched her forearm lightly. Thank you for staying. The words were ordinary. They hit harder than anything Calder had said about medals. Mara nodded. You're welcome. Rebecca walked away with Elena Ruiz. Mara watched until the elevator closed. At 11:16, the security alert was reduced from full lockdown to controlled access. The decision was not Mara's. She disagreed with it. She said so once. Colonel Grant listened. Then explained that every known exit had been covered for hours, no confirmed sighting had occurred since 6:05, and continuing full lockdown was creating risks of its own. Mara did not like the answer. That did not make it wrong. She accepted it. At 11:39, a federal investigator showed her a list of employees and physicians whose badges had accessed Level 8 after 5 o'clock. The name Adrian Kell appeared twice. Mara stared at it. That badge should have been disabled. It was, the investigator said. Then why is it here? We're trying to determine whether the record is a system artifact. Where? North stairwell at 8:52. Physician corridor at 10:58. Mara looked at him. He's still inside. We don't know that. The badge moved. The system says it moved. What's the difference? The difference is evidence. Mara respected the answer. She still hated it. Tell Grant. He knows. At 11:51, the fake surgeon stood inside a staff restroom on level 8 and adjusted a clean blue cap over his hair. He wore surgical scrubs again. A mask covered the lower half of his face. The false badge had worked often enough to get him where he needed to be. Not everywhere. Enough. He waited. The hospital had become quieter. That was what he needed. Not empty. Hospitals never emptied. Quieter was better. At 12:06 a.m., Mara poured herself coffee she did not want. At 12:08, she threw it away without drinking it. At 12:11, Julia told her to sit down. At 12:12, Mara sat. At 12:14, she stood again. Julia looked at her. You lasted 2 minutes. Personal best. You are making me tired by proximity. I can stand farther away. Julia pointed at the chair. Mara sat again. For 11 minutes this time. At 12:25, the repeat labs came back. The trend Mara had noticed was worse. Not catastrophic. No dramatic alarms. But the general's hemoglobin had fallen more than Vane expected. His heart rate was climbing. His pressure remained acceptable because his body was doing what trained bodies and stubborn bodies sometimes did. It was compensating. Mara called Vane. He arrived at 12:37. He reviewed everything. This can be post-operative redistribution. Can be, Mara said. Vane looked at her. She deliberately kept her voice neutral. His abdominal exam is more tender. He just had abdominal surgery, more than an hour ago. Vane examined Calder again. The general was awake but quieter. Too quiet for him. Vane ordered repeat imaging. Mara said nothing. At 12:49, transport was delayed because the protected patient security escort had to be coordinated. At 12:55, the general's pressure dipped. Then recovered. Mara watched the number. Calder watched her watching it. Bad? He asked. Annoying. That means bad. It means stop talking. It means stop talking. That definitely means bad. Mara adjusted his blanket. You're not dying. Comforting. You prefer lying? No. Then enjoy the service. He closed his eyes. At 1:03, imaging became available. At 1:08, the general was moved downstairs under escort. Mara went with him. The hallways after midnight had a different architecture. Same walls, different human density. A doorway that meant nothing at noon became a blind corner at 1 in the morning. A service elevator that opened every 3 minutes during the day could sit silent for 20 at night. Mara noticed all of it because she could not stop noticing. She had tried. For 6 years. Some things stayed. At 1:19, imaging showed a slow post-operative bleed. Not enough for immediate open surgery. Enough to require intervention and closer monitoring. Vane's expression changed when he saw it. He looked at Mara. Not long. Just enough. You were right to push the repeat, he said. Mara blinked. It might have been the first directed mission in 6 years. She did not make it larger than it was. He was changing. I know. Vane looked at the scan. Then said, "We can manage this without taking him back to the OR if the next 30 minutes hold." Mara nodded. Agreed. Again, that small surprise in his face. He was discovering something that people often discovered late about Mara. She did not need to oppose him. She needed the patient treated. At 1:31, Calder returned to room 814. At 1:38, his pressure stabilized. At 1:43, Julia left to assist with another ICU admission. Mara remained. At 1:47, Colonel Grant was called to the security desk because a camera system had finally produced a possible match from level 7. He put a younger officer named Lieutenant Mason outside the room. Mason was competent. Mara had no reason to worry. At 1:52, Dr. Vane went downstairs to review the new ICU admission. At 1:55, General Calder fell into a light sleep. At 1:58, Mara checked his lines. At 2:01, she wrote her note. At 2:04, the nurse station received a call. A physician asked whether Dr. Vane was still with Calder. The clerk said no. The physician said he had been asked to perform a brief post-operative vascular reassessment. The clerk told him all physicians required security confirmation. He said, "Of course." At 2:07, Lieutenant Mason received a radio request to assist at the west elevator, where a man matching the intruder's description had reportedly been seen. He hesitated. Protocol said the room should not be left uncovered. A second officer was supposed to replace him. The second officer was 30 seconds away. Mason waited. That mattered. The replacement arrived at 2:08. Mason left. At 2:09, the man in surgical scrubs appeared at the far end of the corridor. He walked calmly. The replacement officer looked up. "Doctor." The man stopped several feet away. Adrian Kell, vascular consult. The officer's posture changed. That name had been flagged. "Stay there." The man raised both hands slightly. "Problem?" The officer reached for his radio. At that exact moment, an alarm sounded from a patient room behind him. Not Calder's. 2 doors down. A nurse shouted for assistance. The officer looked toward the sound. 1 second. Then back. The surgeon was gone. Not running. He had stepped through a service door 10 feet away. The officer called it immediately. At 2:10, Colonel Grant heard the radio traffic from the elevator. At 2:10 and 20 seconds, he started running. At 2:11, Mara heard the service door close at the far end of the hall. She looked up from Calder's chart. The general slept. The room door was half open. The security officer outside was not there. Mara stepped into the hall. "Lieutenant?" No answer. Then she saw the man. Blue cap, mask, surgical scrubs, walking toward her from the service corridor. He carried nothing. His badge read, Adrian Kell. Mara's heartbeat slowed. The world sharpened. He stopped 6 feet away. Nurse Bennett. He knew her name. Mara did not move. "You're not Dr. Kell." He tilted his head. "No?" "No." His eyes changed. Only slightly. "Enough." Mara heard distant footsteps from the elevator corridor. Grant, maybe. Security, maybe. Too far. The fake surgeon looked toward room 814, then back at Mara. "I need to assess the patient." "No." "I have orders from Dr. Vane." "No, you don't." "You've had a long shift." "So have you." Something like amusement touched his eyes, then disappeared. Mara stepped sideways, placing herself between him and the room, not aggressively, simply there. The footsteps grew louder. The man looked past her again. His calculation changed. He smiled politely. "Then I'll come back." He turned. At that exact moment, the west corridor door opened, and two hospital security officers appeared. The fake surgeon stopped. Mara saw his shoulders tighten. The officers saw him. "Sir, stay where you are." He looked left, right, then at Mara. For 1 second, she thought he might surrender. Instead, the overhead lights flickered. Once, twice. A backup power transition somewhere in the building. The hallway went dim for less than 2 seconds. When full light returned, the fake surgeon was already moving through room 814's door. Mara moved with him. She did not think. Thinking was too slow. The general woke at the sound of the door hitting the wall. "What?" The man reached back and locked the door. Mara was inside. So was he. So was Calder. Outside, security hit the door. The fake surgeon turned. For the first time, the calm left his face. "You should have stayed out of this." Mara stood between him and the bed. "I tried." He reached beneath his gown. Mara saw the movement in the dark television screen. Not his hand first. The reflection. The shape coming free beneath the fabric. A compact black handgun. Everything became very simple. The bed behind her. The weapon in front of her. The locked door. 3 seconds, maybe less, before someone outside forced entry. The attacker raised the gun. Mara knocked the medication tray sideways. Metal hit tile. He turned his head. She moved. The first contact drove the weapon away from Calder. The second sent the visitor chair crashing into the wall. The gun struck the floor and slid beneath the cabinet. The attacker hit Mara hard enough to make the room flash white at the edges. She stayed upright. He reached for the weapon. She got there first with her foot, sending it farther beneath the cabinet. He grabbed her shoulder. Mara drove into him, not elegantly, not like a demonstration, simply with the violent efficiency of someone who understood one thing mattered more than everything else. Keep him away from the bed. They hit the wall. A framed print fell and shattered. Calder was shouting now. Outside, the door buckled once. The attacker swung. Mara blocked enough of it that the blow caught her cheek instead of her temple. Pain flared. She tasted blood. He was stronger than she was. That was information, not destiny. He tried to move around her. She did not let him. The door burst open. Colonel Grant came through first. 2 security officers behind him. The attacker made one last movement toward the cabinet. Mara caught his arm and drove him down, just as Grant reached them. Then the room filled. Hands. Orders. Boots. The attacker pinned to tile. The gun recovered. Mara stepped back. Her breathing was hard now. Her cheek burned. Her right hand shook once, then stopped. General Calder stared at her from the bed. He had gone pale. Not from his injuries, from recognition. "Mara," he said. She turned. His eyes moved over her posture, her hands. The way she stood after violence, scanning the room before allowing herself to feel it. He knew. "Sergeant Bennett?" The words carried through the broken doorway. Dr. Marshall Vane had arrived in time to hear them. So had Julia. So had Denise Holloway. So had half the people who would spend the next week repeating the moment to everyone who had not been there. Mara closed her eyes for 1 second. When she opened them, Vane was staring at her. Not with authority, not with irritation, with the expression of a man who had just discovered the person he had been measuring for 6 years had been standing outside the scale. Colonel Grant hauled the fake surgeon upright with help from security. The man's mask had come off. Blood marked one corner of his mouth. He looked at Mara and smiled. It was the wrong reaction. Mara felt it immediately. Not defeat, not fear. Satisfaction. She looked at Grant. He expected to be caught. Grant turned. What? The attacker's smile disappeared. Mara's heart went cold. He expected this. Grant looked at the man, then at the room, then at Calder. The general's monitor alarmed. His heart rate had jumped. His pressure was falling. Julia moved to the bed. General? Ah! Calder's eyes lost focus. Mara was beside him instantly. The attacker had never reached the bed, never touched a line, never fired the gun, and yet Calder was deteriorating. Vane pushed into the room. What happened? Pressure dropping, Julia said. Bleed? Maybe. Mara looked at the line running into the general's arm, then at the medication bag. It had been replaced 20 minutes earlier. By whom? She looked at Julia. When was that hung? 1:49. Who brought it? Pharmacy runner. Mara's eyes went to the label. The room seemed to narrow again. Not the gun. The gun had been theater. The real attack had started before he entered the room. Stop the infusion, Mara said. Vane turned sharply. Why? The bag. What about it? What about it? I don't know yet. Stop it. Vane looked at the label, then at the crashing pressure. He did not argue. Stop it. Julia clamped the line. Mara felt something inside her shift. For 6 years, Marshal Vane had required proof before trust. For the first time, he trusted before proof. It may have saved Nathan Calder's life. The next 12 minutes were not cinematic. They were medicine. Fast, controlled, crowded medicine. The team stabilized the general, identified that the infusion bag did not match what had been dispensed under his current order, and treated the reaction without waiting for the full explanation of how the wrong solution had reached the room. Mara did not solve it alone. Vane did not solve it alone. Nobody did. That mattered. Because the difference between a hero story and a real hospital was that real hospitals survived on teams. At 2:28 a.m., Calder's pressure began climbing toward something safe. At 2:31, his eyes opened. Mara was standing at the foot of the bed. Vane was beside her. Calder looked at both of them. Then at the restrained attacker beyond the doorway. I assume, he whispered, I missed something. Mara exhaled. Vane laughed once from pure relief. It sounded almost broken. You could say that, he said. Calder looked at Mara's cheek. You're bleeding. So are you. I was here first. Congratulations. His eyes closed again. The monitor held. At 2:39, Colonel Grant stepped into the room. His face was harder than before. The man is in custody. Mara looked at him. The infusion? Being treated as evidence. Who delivered it? We have a camera image. Same man? No. The room went still. Grant continued. Different person. Vane's face changed. Mara felt exhaustion disappear beneath something colder. How many? She asked. We don't know. The fake surgeon had not come alone. And somewhere inside St. Catherine's Medical Center, another person who had participated in an attempt to kill General Nathan Calder had not yet been found. The second lockdown began at 2:41 a.m. This time nobody argued. A gun had been recovered beside a protected patient, and a compromised infusion had reached the same room through a second set of hands. Debate was over. Julia cleaned the cut on Mara's cheek in an empty treatment room. Her own hands trembled as she worked. I hung that bag, Julia whispered. You hung a sealed bag delivered under a valid order, Mara said. I should have known. Known what? Julia had no answer. Don't build evidence backward, Mara said. You know the ending now, so your brain is inventing signs you think you should have seen before. That is not the same as those signs being there. Julia looked at her. But you caught it. The attacker smiled after he was caught. He looked satisfied. That told me the gun might not have been the whole plan. Julia's eyes filled. That is terrifying. Yes. I meant you. Mara almost smiled. Then Julia began to cry. Mara put a hand between her shoulder blades and let the silence do what reassurance could not. At 2:58, Colonel Grant found Mara outside the treatment room. We have the pharmacy camera. She straightened. Show me. He held up a tablet. The image showed a man in a hospital courier jacket pushing a sealed medication container through a service hall at 1:42 a.m. The face was partially visible. Mara did not recognize him. Employee? No match. Real courier? Located. He was sent home sick at 11. Somebody used his route after he left. Mara looked at the image again. Where did this man go? Camera loses him near the old pharmacy connector. Again. Yes. Your cameras are terrible. That observation has been made. By everyone? Mostly with stronger language. Grant swiped to another image. The same man appeared entering a freight elevator. Timestamp, 1:57. Down? Mara asked. Basement. Loading dock. Yes. Did he leave? No confirmed exit. Mara looked at the time. Over an hour ago. Grant's radio crackled. He listened. His face changed. Say again? The voice repeated something Mara could not make out. Grant turned toward the stairwell. They found him. Where? Laundry tunnel near the south loading bay. Alive? Yes. Armed? Grant did not answer immediately. Mara understood. Go. He went. She did not follow. That surprised her. Maybe she was learning. Maybe she was simply tired. At 3:11, the second intruder was taken into custody without reaching another patient area. He had been hiding behind stacked linen carts, waiting for a chance to reach an exterior service door. He carried false identification and a phone that federal investigators immediately sealed as evidence. He did not work for St. Catherine's. He had never worked for St. Catherine's. He had entered the building during the confusion around the general's emergency arrival, wearing a contractor uniform that nobody remembered clearly enough to describe. That fact bothered Mara more than she admitted. People thought danger announced itself. Most danger preferred a clipboard. At 3:24, the first attacker gave his name, Cole Danner. Former private security contractor, 43 years old. No current medical license because he had never held one. His connection to the general was not immediately clear. His connection to the second intruder was. They had worked for the same overseas security company 8 years earlier. The company no longer existed under that name. Its successor did. Orion Ridge Logistics. General Calder had mentioned procurement fraud. Mara stood beside Colonel Grant when the name appeared on the investigator's preliminary report. She felt something settle into place. Calder's evidence is about them. Grant nodded. Partly. Keene died because of procurement fraud? We don't know enough yet. You know what I mean. Yes. Mara looked through the glass toward room 814. The general slept under heavier monitoring now. His pressure had stabilized. The compromised medication had been identified and treated quickly enough that the team expected no lasting injury from it. He had survived the crash, the bleed, the surgery, the false surgeon, the poison bag. Mara did not use the word lucky. Luck was too simple for a chain containing that many people making the right decision one after another. At 3:42, Elena Ruiz joined them. Her uniform jacket was gone. Sleeves rolled to the elbows, hair coming loose at the back. She looked at Mara's cheek. What happened to you? Wall. The wall have representation? Probably hospital legal. Elena stared at her for 1 second. Then laughed despite herself. The laugh vanished quickly. They identified Danner, Grant said. I heard. Orion Ridge. Elena's face hardened. Then it is the evidence. Mara looked at her. What exactly did Calder find? Elena hesitated, then seemed to make a decision. 5 years of contracts for medical evacuation equipment, protective systems, and communications packages. Deliveries certified, payments made. Some units received partial equipment, some received substitutes, some received nothing. Mara's stomach tightened. Medical evacuation equipment. Yes. How many failures? We don't know. That means more than one. Elena looked tired. Yes. Mara thought of places where a missing piece of equipment was not an inconvenience. Places where there was no second supply closet. No next ambulance. No administrator to call. What happened this morning? Calder and Keene were moving to a secure meeting. Their route was altered less than an hour before departure. A truck crossed the median at exactly the point where their vehicle had no escape lane. Driver? Dead. Truck driver? Missing. Mara closed her eyes briefly. Elena continued. Danner's company records tie him to an Orion Ridge subcontractor. The second man has the same connection. If the phone evidence confirms coordination, the case stops being procurement fraud with suspicious deaths and becomes something else. Murder. Yes. The word sat between them. Mara looked through the glass again. General Calder moved slightly in his sleep. What about Keene's family? Elena's face softened. They know he died in the collision. They don't know the rest yet. They will. Yes. When? When we know enough to tell them something true. Mara nodded. That was the right answer. At 4:06, Dr. Marshall Vane asked Mara to meet him in consultation room 3. She expected an argument. She got something stranger. He closed the door, then stood beside the table without sitting. Mara remained near the door. Vane looked at the bruise forming along her cheek. I was wrong. No preamble. No qualifying clause. Mara waited. Vane swallowed. About Kell. About the security concern. About removing you from Calder's care earlier. Mara said nothing. He looked down at the table. I kept interpreting everything you did through a conclusion I had already made about you. That was more precise than she expected. You thought I overstepped. I still think you overstep. Mara almost laughed. Vane raised a hand. Let me finish. She did. I think you sometimes move before the formal chain catches up. I think that creates risk. Sometimes. But I also think I have been using the word overstep when what I meant was challenge. Mara looked at him. And I don't like being challenged, Vane said. No, I know. He took a breath. Tonight, I trusted you on the infusion before you had proof. Yes. If I had responded the way I normally respond to you, we would have lost time. Yes. The word hurt him. Mara did not soften it. Some truths needed their full weight. Vane looked at her. I'm sorry. Mara believed he meant it. That did not erase 6 years. She also believed that. Thank you, she said. His expression shifted, maybe expecting forgiveness, maybe not. Mara continued. I need something more useful than an apology. What? The next time a nurse on your floor tells you something changed, don't make them prove they're allowed to notice it before you listen. Vane went still. Mara opened the door. That would be useful. She left him there. At 4:31, General Calder woke again. His first question was whether Danner had been caught. His second was whether Mara had been checked for a concussion. His third was whether anyone had told Rebecca what happened. That order told Mara almost everything she needed to know about him. "Danner is in custody," she said. "My head is fine. Rebecca has been told there was a security incident and that you're stable." Calder watched her. "Security incident. That is what Colonel Ruiz chose. Very elegant. She has improved with age." "I heard that," Elena said from the doorway. Calder looked past Mara. "Did they get the second one?" Elena entered. "Yes." The general closed his eyes. For a moment, relief moved across his face. Then grief replaced it. Keen. Mara knew where his mind had gone. Calder opened his eyes again. "If I hadn't pushed to move the evidence today," Elena said. "Sir, if I had waited for the secure transport window," Mara interrupted. "No." Both of them looked at her. Calder's eyes sharpened. Mara stepped closer. "You don't get to do that." "Mara." "No." Elena did not stop her. The general stared. Mara continued. "You can review the route. You can review the intelligence. You can ask what should have been different. That is responsibility. But you do not get to take the decision of the people who attacked your vehicle and put it on yourself because grief wants somewhere closer to live." Calder's face changed. Mara felt her own throat tighten. She had not planned those words. Maybe she had been carrying them for someone else. Maybe for herself. "You taught me that," she said quietly. Calder looked at her. "When?" "Red Quarry." The room went silent. Mara had not intended to say the name again. Now that it was there, she could not take it back. "You told me I could own every decision I made, but I could not own the man who fired the mortar." Calder closed his eyes. "I remember. I didn't believe you for years. And now?" Mara thought about it. "I'm trying." Calder's eyes filled. He turned his face toward the window. Nathan Calder was a 4-star general. He had testified before Congress. He had commanded tens of thousands of people. He had stood at funerals and said words for families when there were no words large enough. At 4:38 in the morning, lying wounded in a hospital bed, he cried silently for Major Daniel Keene. Mara stayed. Elena stayed. Nobody told him to be strong. At 5:17, federal investigators confirmed the second intruder's identity as Victor Hale, a former logistics coordinator who had worked under an Orion Ridge subcontractor. At 5:42, data from his phone tied both men to a third person outside the hospital. At 6:08, that person was arrested at a private airfield 30 miles away. At 6:26, investigators recovered the device containing the evidence General Calder had been carrying. It had never been in the hospital. Major Keene had transmitted a duplicate set before the vehicle moved that morning. The attack had failed before the attackers knew it had begun. Calder learned that at 6:41. He laughed once, then covered his eyes with one hand. "Daniel," he whispered. Elena smiled through tears. "He did his job." "No," Calder said. "He did everybody's job." Mara stood at the foot of the bed and thought about a 26-year-old lieutenant with hot sauce in his pocket. A man who had become a major, a husband, a father, a man who had protected the evidence even while dying. She hoped somebody told his daughter one day in language a child could understand. Not that her father had been a hero. Children heard that word until it became abstract. She hoped someone told her what he actually did. He thought ahead. He protected people he would never meet. He finished the work. At 7:02, morning shift arrived to a hospital that looked the same from the outside. Inside, nothing felt the same. News had traveled despite every attempt to contain it. Not details. Enough. There had been a gun, a fake surgeon, a protected patient. Nurse Bennett had stopped him. By 7:10, 3 versions of the story existed. In one, Mara had disarmed 2 men alone. In another, she had recognized the assassin from a classified mission overseas. In a third, she had been secretly assigned to protect the general all along. All 3 were wrong. Mara found this reassuring. Hospitals remained hospitals even during federal investigations. At 7:18, Denise Holloway cornered her beside the supply room. "You have been awake how long?" Mara calculated. 26 hours, approximately. "Go home. I need to finish." "No." "Denise." "No. You are no longer allowed to use competence as a substitute for sleep." Mara looked at her. "That is annoyingly reasonable. I learned from you. Then I regret everything." Denise's face softened. She stepped closer. "Are you okay?" Mara considered the question. Her cheek hurt. Her shoulder hurt. Her hands felt too light, the after effect of adrenaline leaving. Daniel Keene was dead. Nathan Calder was alive. 2 men were in custody. The quiet identity she had protected for 6 years had cracked open in front of half the ICU. "I don't know yet," she said. Denise nodded. It was the right response. Not reassurance. Not advice. Just acceptance. Then the elevator opened. 4 military personnel stepped out. Mara recognized the first 2 immediately. Sergeant Major Owen Reddick and Colonel Nia Brooks. 12 years had changed their faces, not the way they carried themselves. Reddick saw Mara and stopped. Doc Bennett. The hallway quieted. Mara closed her eyes for 1 second. Sergeant Major. Reddick looked at the bruise on her cheek. "You still getting into arguments with walls?" "Only badly designed ones." He laughed and hugged her carefully. Nia followed, eyes already wet. They had come for Keene, not for spectacle. That made seeing them harder. Denise stood nearby, trying to fit this version of Mara into 6 years of ordinary shifts. "Doc Bennett?" she whispered after they moved toward the waiting room. "No." "Colonel Brooks?" "No." "Old classified unit?" "Absolutely no." Denise stared after Reddick. Every answer creates more questions. That sounds inefficient. Across the corridor, Marshal Vane had seen the reunion. He watched experienced soldiers straighten instinctively when Mara passed them. No salute, no performance, just recognition. Mara disliked the attention, but she understood what the people around her were finally seeing. Authority was a language. Some people refused to hear truth until someone with visible rank translated it. At 8:04, Mara finally left the hospital and slept for 5 hours. When she woke, Denise had texted only what mattered. "Calder stable." Vane asked if you called. "I told him you were asleep like a person with common sense." Elena had sent another message. "Keene's wife is coming tomorrow. She asked to meet you." Mara answered one word. "Yes." The next morning, Major Daniel Keene's widow arrived at St. Catherine's carrying a diaper bag. Her name was Laura. Her daughter was 11 months old. Mara had expected grief to make Laura look fragile. It did not. Grief had made her look precise. Every movement deliberate, as though if she stopped controlling small things, the large thing would swallow her. She sat across from Mara in consultation room 3, with the baby asleep against her chest. Elena had offered to stay. Laura asked to speak to Mara alone. "I heard you knew him," Laura said. "A long time ago. He talked about that deployment sometimes. Not much." Mara nodded. "He was good." Laura's eyes filled immediately. Mara regretted the simplicity of the sentence. Then Laura said, "Everyone keeps saying that." Mara waited. "Good man, good officer, good father, brave. Hero." Laura looked down at the sleeping baby. "I know all of that, but those words feel like they belong to a funeral program." Mara understood. "What do you want to know?" Laura looked at her. "What was he like when nobody was watching?" Mara leaned back. Memory arrived slowly. "He cheated at cards." Laura blinked, then laughed through tears. "He absolutely did. He carried hot sauce everywhere." "Yes. He sang badly when he was tired. Country music. Only one verse. He never knew the rest." Laura covered her mouth. The laugh became crying. Mara let her cry. After a while, Laura whispered, "Was he scared?" Mara knew she was asking about the crash. "I wasn't there. I know. The people who were say it happened very fast." Laura's eyes closed. Mara continued carefully. "General Calder told me Daniel did not appear aware after the impact. I think if anyone had time to be afraid, it was before, not after." Laura nodded. The baby moved against her. She adjusted the blanket automatically. "Did he save the evidence?" Mara looked at her. "They told me some of it." "Yes," Mara said. "He did." Laura's face broke. "Of course he did." Mara reached across the table. Laura took her hand. For several minutes, neither woman spoke. The baby slept between them. A life Daniel Keene had created. A future he would not see. And Mara understood something that had taken her years to learn. You did not honor the dead by turning them into symbols. You honored them by remembering the ridiculous things too. The bad singing. The stolen hot sauce. The cheating at cards. The parts that proved they had been alive before they became a story about how they died. At 11:12 that morning, federal investigators arrested 2 Orion Ridge executives. A third surrendered before evening. The case widened quickly beyond St. Catherine's. Fraud, obstruction, conspiracy, the deliberate collision, and Major Keene's death. Mara followed only what she had to. She still had patience. Peter Hall caught a subtle respiratory change before she did and looked absurdly pleased. The broken cabinet latch in Trauma 4 was finally replaced. A junior nurse raised a concern during rounds and, for the first time Mara could remember, Marshal Vane stopped and asked, "What are you seeing?" That mattered more to her than the rumors. People had not suddenly discovered that Mara was competent. They had discovered that their old measurement of her had been incomplete. General Calder remained at St. Catherine's for 11 days. By the 7th, he was walking with a cane and insulting every breakfast tray. By the 10th, he knew the entire night staff by name. On discharge morning, he asked Mara to close the door. "There's going to be a ceremony," he said. "No. I haven't explained it. You said ceremony." Calder sighed. "Army Medical Command wants to recognize the hospital team." "Good. I'll stand in the back. You tackled an assassin. That is an excellent reason to keep me away from crowds." His smile faded. "Your old record was reviewed because Danner's attorneys questioned your training. Only the minimum needs to become part of the case." Mara went still. "The classified parts? Remain protected. The Red Quarry citation can stay sealed if you want." "I do." Calder nodded. Then, quietly, "You left because people kept pointing at the 14 you saved, and you kept looking at the 2 who died." Mara looked away. "Success is not perfection," he said. "You teach that to everyone except yourself." She picked up his discharge packet. "Physical therapy Monday at 9. Coward. Patient." At the door, Calder said, "Mara." She stopped. "Thank you. Not only for the gun, not only for the bleed, for all of it." "You're welcome, sir." "Nathan." "No." He laughed and left the hospital alive. 3 weeks later, the hospital held the ceremony anyway. Mara attended only because Laura Keene sat in the second row holding her daughter. Calder spoke about the flight crew, trauma staff, surgical team, Julia, Okafor, Vane, Grant's security detail, and Major Daniel Keene. The atrium stood in silence for the man who had protected the evidence even while dying. Then Calder looked at Mara. "There is one person who has spent several weeks asking me not to discuss her past," he said. "I am going to respect most of that request." Mara narrowed her eyes. Reddick looked delighted. Nurse Mara Bennett served 8 years in the United States Army before becoming a registered nurse. Her full record remains her own business. What matters is that the calm people saw in room 814 was not created that night. The judgment people saw in the trauma bay was not created that morning. The atrium went silent. "I once knew her as Sergeant Bennett. You know her as Nurse Bennett. The second title is not smaller." Mara stopped breathing. That was the sentence she had spent 6 years trying to understand. Not smaller. Different. No old medal was unveiled. No classified history was dragged into the light. The hospital team received a collective commendation for what they had done now. Then Laura Keene walked to Mara carrying her daughter and held out a small bottle of hot sauce. Mara stared at it. "He would have thought this was hilarious," Laura said. Mara laughed, and the laugh broke into tears. Laura hugged her. The baby reached for Mara's badge. Behind them, Elena wiped her eyes. Reddick did not bother pretending. Even Vane looked away. Mara hated applause. She stood inside it anyway. Later, after the atrium emptied, Vane found her near Trauma 4. The new cabinet latch clicked shut correctly when she tested it. Bennett. She looked at him. He stood with his hands in his coat pockets. "I wanted to tell you something before it becomes awkward enough that I avoid it for another 6 years. That is unusually self-aware. I'm trying." Mara waited. "I recommended you for trauma clinical lead." She stared at him. "No. You haven't heard the job. It has lead in the title. You already do half of it unofficially." "That sounds like a management problem," Vane sighed. "Protocol review, nurse training, cross-disciplinary simulation, authority to stop a process when you identify an immediate safety concern pending physician review." Mara's expression changed. Vane noticed. "That last part," he said, "was Dr. Okafor's condition for accepting the new trauma governance plan." New governance plan? The board reviewed the security incident and some broader communication failures. Mara looked at him. "Broader, yes, meaning you, among other things." He did not flinch. That mattered. Vane continued. "I've been asked to complete leadership remediation." Mara raised an eyebrow. "Is that hospital language for somebody finally told you you're difficult?" "Yes." She almost smiled. "I deserved that." "Yes, that too." They stood there for a moment. Then Vane said, "Think about the role." Mara looked through the glass into Trauma 4. Peter Hall was explaining something to a patient. A new nurse stood beside him listening. The nurse asked a question. Hall stopped. Actually stopped. And listened. "What are you seeing?" he asked. Mara heard the words through the partially open door. Vane heard them too. Neither said anything. "I'll think about it," Mara said. Vane nodded. That was enough. The federal case took 11 months to reach its first convictions. Danner, Hale, and 2 Orion Ridge executives were held accountable for crimes connected to the attack, the fraud scheme, and Major Keene's death. Mara testified twice. When a defense attorney suggested her military background made her inclined to perceive threats, she answered, "My nursing training makes me notice changes. My military training taught me that ignoring them can be expensive." General Calder retired 6 months later and began speaking publicly about procurement accountability and the need for information to travel upward. After one interview, Mara texted him, "That sounds familiar." He replied, "I had a good nurse. She saved the message." Mara accepted the trauma clinical lead role after negotiating the title down twice and the administrative meetings down by approximately 40%. Denise claimed this was the most Mara thing anyone had ever done. Her first policy change was simple. Any staff member could call a 2-minute clinical pause if they believed a patient was deteriorating and their concern had not been heard. No punishment. No hierarchy debate during the pause. 2 minutes to look again. Vane approved it. The first time it was used, a 23-year-old nurse called the pause on a patient whose monitor looked normal but whose behavior had changed. The patient was developing sepsis. They caught it early. Nothing dramatic happened. That was the point. The best emergencies were the ones that never became emergencies because somebody spoke soon enough. 2 months after the new pause policy went live, Mara received a plain envelope at the nurse station. There was no return address she recognized. Inside was a photograph. Laura Keene sat on a porch with her daughter on her lap. The baby was laughing at something outside the frame. Beside the photograph was a handwritten note. Daniel used to say the hardest part of coming home was learning that quiet did not mean something bad was about to happen. I think I understand that now. Thank you for telling me who he was before he became everybody else's hero. Mara read the note twice, then a third time. She put it in the top drawer of her desk beneath the hot sauce bottle from the ceremony. She did not tell anyone about it. That afternoon, the clinical pause was called for the second time. The nurse was Chloe, still new enough to apologize before speaking. "I'm sorry," Chloe said. "I know the numbers look okay, but he is not acting like he did 20 minutes ago." Vane was standing at the foot of the bed. 6 months earlier, Mara knew exactly what would have happened. He would have looked at the monitor first. He would have explained why the numbers mattered. He might even have been correct. This time he looked at Chloe. "Don't apologize. Show me." Chloe did. The patient turned out to be developing an internal complication that had not yet changed the obvious measurements. They caught it before it became an emergency. Afterward, Vane found Mara at the desk. "You were watching," he said. "I was working. You were watching me work. That sounds self-important." He ignored that. "I almost looked at the monitor first." "But you didn't." "No." Mara closed the chart in front of her. Vane leaned one shoulder against the counter. He had become better at admitting things without turning the admission into a speech. Mara appreciated that. "I spent years thinking authority meant being the person who had the answer," he said. "What do you think now?" "That it might mean being the person who makes it safe for somebody else to have one." Mara looked at him. "That sounds dangerously healthy. I dislike it. I can tell." He almost smiled. Then his expression became serious. "You know I can't undo the way I treated you." "No. I also know the apology didn't fix it." "No." Vane nodded. "What does?" Mara looked across the unit. Chloe was explaining a new order to the patient's wife. Peter Hall was helping a transporter move equipment instead of standing in the way. Denise was arguing with scheduling over a nurse who had worked too many consecutive nights. Ordinary people doing ordinary work better than they had before. "You keep listening," Mara said, "for longer than one dramatic week." Vane followed her gaze. Fair. That evening, Mara left before sunset and sat for a while in a small military memorial park. She thought about Daniel cheating at cards, Reddick's ruined jacket, Calder's oatmeal, and the boy with the broken toy truck. The memories did not make the losses smaller. They made the people larger than the losses. The next morning she returned to St. Catherine's, checked the assignment board, moved one name because Denise had accidentally scheduled a nurse into 2 rooms at once, and started her shift. No one saluted. No one applauded. Nothing exploded. It was one of the best mornings she had had in years. 1 year after the night in room 814, Mara arrived for work at 6:52 a.m. 8 minutes early. Denise noticed. Showing off? Traffic was kind. Suspicious. Mara put her bag beneath the desk. Trauma 4's cabinet latch still worked. Peter Hall was now a second-year resident with enough confidence to be useful and not enough to be dangerous. Julia had transferred into trauma quality and still reminded Mara that she had once admitted Julia was right about stitches. Marshall Vane remained chief of trauma. He was not a different man. He was a man doing some things differently. Mara had decided that mattered more. At 7:11, the main desk called her. "There's someone here to see you." "I'm working." "He says he knows." "Name?" "What?" "Nathan Calder." Mara closed her eyes. Of course. She went to the lobby. Calder stood beside the windows in a dark coat. No cane. Rebecca was with him. So was a little girl Mara did not recognize until Rebecca said, "This is my daughter Sophie." Sophie was 4. She held a toy ambulance in one hand. Calder looked healthy, older, lighter somehow. Retirement had removed something from his shoulders that physical therapy never could. "What are you doing here?" Mara asked. "Annual follow-up." "Your follow-up is at Walter Reed." "I was in the neighborhood." "You live an hour away." "Large neighborhood." Rebecca smiled. "He wanted to bring you something." Calder handed Mara a small paper bag. She looked inside. Oatmeal. Mara stared at him. He smiled. "I wanted you to experience what I survived." Sophie giggled. Mara looked at Rebecca. "You brought a child into this." "I tried to stop him." "No, you didn't." "No." They stood together in the lobby for 10 minutes. No ceremony. No uniforms. No security detail anyone could see. Just people. Before leaving, Calder looked at Mara's badge. It now read, "Mara Bennett, RN Trauma Clinical Lead." "You kept the title," he said. "I lost the negotiation." "You?" "Technically, Dr. Okafor threatened me." "Good woman." Calder's expression softened. "You happy?" Mara looked through the lobby toward the emergency corridor. A transporter pushed an empty wheelchair past. A family stood near the admissions desk speaking quietly. A nurse hurried toward radiology carrying a chart. Ordinary motion. Ordinary work. The thing Mara had wanted for years. "Most days," she said. Calder nodded. "That's probably the right amount." Rebecca hugged Mara. Sophie waved. Calder put out his hand. Mara looked at it, then hugged him instead. He went still in surprise, then hugged her back. It lasted 2 seconds. Maybe 3. Enough. When they were gone, Mara returned to Trauma 4. A new nurse named Chloe stood beside a patient bed looking worried. Dr. Vane was reviewing the chart. Chloe said, "Something's different." Vane looked up. "What are you seeing?" Chloe explained. Vane listened. Mara stood in the doorway and watched for 3 seconds. Then she stepped inside. The patient was pale. Not dramatically. Enough. Mara looked at Chloe. "Good catch," she said. Chloe's shoulders lowered slightly. They went to work. That was how the story actually ended. Not with the gun on the floor. Not with the fake surgeon in handcuffs. Not with a 4-star general saying a hidden military title in a room full of stunned people. Those were the moments people remembered because they were loud. The real ending was quieter. A young nurse noticed something. A senior doctor listened. A patient was treated before the situation became a disaster. And Mara Bennett, who had spent years believing the only version of courage anyone would ever value was the kind that happened under fire, finally understood that this counted too. The night she stopped Cole Danner, everyone at St. Catherine's learned that the quiet nurse had once been a soldier. Mara learned something different. She had never stopped being one kind of person and become another. She had simply carried the same promise into a different room. See what others miss. Move when waiting becomes dangerous. Keep the person in front of you alive. The uniform had changed. The work had not. At 7:19 that morning, Chloe called for the attending. Vane answered. Mara reached for the equipment they would need before anyone asked. Outside, the hospital doors opened and closed. Ambulances came and went. The city moved through another ordinary day without knowing that 1 year earlier, at 2:13 in the morning, a man had entered room 814 with a stolen surgeon's name and a gun. He had expected a wounded general to be helpless. He had expected a hospital to be tired. He had expected a nurse to step aside. He had been wrong about all three.